Hello, everyone. Thank you for joining our new webinar series, Keeping Up with COVID, Therapeutics Part 1. Today, we're going to focus on monoclonal antibodies. So first, we'll start with EVYSHALD. The indication for EVYSHALD is for pre-exposure prophylaxis only in adults and pediatrics age 12 and up, weighing at least 40 kilograms. Now, this is for those who have not currently been infected or have not had any known recent exposure to COVID-19. It's also indicated for moderate to severe immunocompromised patients, and also for those who are not able to mount an adequate immune response from vaccination. So it's not a substitution for vaccination, but for some reason, if they're not able to get the vaccine or they couldn't mount that immune response, then they would be eligible for this therapeutic EVYSHALD. For the dosage is the same for pediatrics and for adults. So the first ingredient is Tropomab, which is 150 milligrams IM injection, and also the second ingredient is Silgabamab, 150 milligrams IM, administered as separate consecutive injections. So you want to administer this at least 2 weeks after COVID-19 vaccination. So you want to make sure that you have at least 2 weeks in between if someone did receive the COVID-19 vaccine. In the PREVENT trial, they did see that EVYSHALD indicated effectiveness for 6 months. So you can hope that these people would have a good immune response for at least 6 months after receiving EVYSHALD. Some of the warnings and precautions, obviously, since it is an injection, you want to make sure that you observe your patients after it's given. It is recommended to observe for at least 1 hour after injection. You might see some cardiac adverse reactions. So some might include cardiac failure, an MI, for example. There hasn't been a good relationship between those adverse reactions to EVYSHALD. They have seen in the trials that these patients did have underlying cardiac risk factors or even underlying history. So there's no real relationship between the two. So no good studies there on those adverse reactions. Renal impairment is unlikely and hepatic impairment is unknown. Also, with a lot of drugs, there's not really a lot of data as far as pregnancy and lactation. It is known that antibodies are likely to cross the placenta, but the benefit and risk really is unknown there. The next therapeutic we're going to talk about is the Tropomab. So this is for treatment, unlike the other, which was pre-exposure prophylaxis. This is for treatment for mild to moderate disease in adults and pediatrics. And again, this is for 12 years and older, weighing at least 40 kilograms. So obviously you must have a positive COVID test in order to use the Tropomab. So Tropomab can be used mostly for those who are at high risk for developing severe disease from getting COVID. So that would mean those who are likely to have hospitalization or death from COVID. It is not authorized for patients who are hospitalized with COVID-19 or who are requiring oxygen therapy for COVID-19 or requiring an increase in oxygen flow rate because of COVID-19. So those who were previously on oxygen, for example. And as far as the dose for Tropomab, it is the same for adults and pediatrics. So it's 500 milligrams as a single IV infusion. You want to administer it as soon as possible after a positive test result, and it must be within 10 days of symptom onset. So that's a very important part there is 10 days of the symptom onset. Some warnings and precautions you want to think about with the Tropomab is you want to monitor again after injection and observe the patient for at least 1 hour after the infusion is complete. And with the Tropomab, renal impairment is unlikely and hepatic impairment is unknown as well. And you want to be on the lookout for some infusion-related reactions. So those would be fever, chills, fatigue, weakness, headache, those sorts of things. And with the Tropomab also, pregnancy and data lactation data are insufficient. And with the Tropomab as well, they are likely to cross the placenta. And again, just like EVYSHALD, the benefit and risk is unknown. Some of the unavailable monoclonal antibodies would be Bamedi and Regencov. So the FDA has revised the EUAs for both of these products and limiting the use to patients who are likely to have been infected with or exposed to a variant susceptible to the treatment. So they have shown that it's unlikely to work against Omicron. So with the prevalence of Omicron, these products really aren't that effective. Treatments are not currently authorized in the U.S. territories or any jurisdictions, and this is in accordance with the EUA guidance. And as we talked about, those alternative therapies would be EVYSHALD and Tropomab, which we just discussed. And some of the implementations of practice, there's a lot of resources that are in the document that are attached to this video. So you'll have documents that talk about billing for administration, specifically Medicare reimbursement, for example, and also some of the fact sheets for these products. And VDH has really good resources on their homepage. So there's the COVID-19 Therapeutics specific website, which there is a resource link on the document as well. And then you also want to be sure to use the VDH COVID-19 treatment locator tool, which again, all of these are on the document that are attached to this video. And thank you so much for watching. I hope that was helpful for everyone.